We appreciate the time that you took, and hopefully you reviewed the materials that were shared in advance. Suki gave us some homework to do for this one. Over the past few months, we've been doing a lot of important listening and learning. So today we have to kind of shift gears and go from gathering information to making some decisions towards getting ready for the commission's next annual report. So hopefully everyone used their voting and ranking worksheets so that we can go through them together and come up with possibly our top 5 priority recommendations that are most actionable and most aligned with prevention. Aubrey, do you want to?
Yeah, I mean, I just want to, I guess, in front of everybody, just say thank you so much to Suki for helping, and the whole team, for helping make the worksheets. We're really hopeful, the listening that we've been doing has been really helpful. I think for me and probably for a lot of people, it feels like we've got a lot of information that we're just kind of sitting with at this point. And we want to make sure that we're in a really good place, because we'll start drafting in May, right? Is that the right timeline, I think? And so we want to make sure that we're kind of ahead of the ball for being able to put forward what those recommendations are going to be, and also be able to like fill in any gaps that we need. I think what'll be really helpful if you've gotten to look through the worksheets already is like there's opportunity for us to kind of identify like this is an issue, but we're not really sure what the concrete recommendation would be yet. And so it gives us an opportunity to identify what other information we need, and whether we need to like do that via research or get that via other presentations or other meetings that would be important to do. So looking forward to going through that with everybody today.
Oh, there's Sandy. Hi, Sandy.
Hi, Delegate Bartlett.
Hi, everyone.
Maybe let's you're here, so let's everybody maybe take a second to just introduce ourselves to everyone, and then we can jump into the worksheets. So Aubrey Edwards Luce, I'm at the University of Baltimore School of Law. I run the Center for Families, Children, and the Courts there, and one of the co-chairs, and I'll pass it to you, Donna.
Donna Christie, the other co-chair. I'm mostly a school psychologist, but I serve on the commission representing the Consortium for Coordinated Community Supports, which is under the blueprint funding for our schools. It is building a behavioral health system for children and families across the state. And I'll go to Suki.
Hi, everyone. I'm Suki McMahon. I staff the commission for GOCAP. I am your commission director, and I am so happy to be here. April?
Hello, everyone. Sorry, I was like, come on, mute button. I'm April Adams. I'm here as, I guess, like the parent, but I previously worked for Maryland Coalition of Families, and I currently am with the Parents Place of Maryland.
So happy to have you, April. You're a parent plus. You bring a lot to the table.
Thanks. And I'm not sure who else to pick.
Let's
I'll go.
Yeah, thank you.
Hi, Maisha Davis, Assistant Secretary for Community Resources with the Department of Juvenile Services. And I just like to attend the prevention work group as an opportunity to stay in alignment with the work you are doing and the work we're doing at the department to expand our continuum. And I'll pass it to Munaza.
Hi, everybody. My name is Munaza. I'm the Continuum of Care Coordinator under Maisha Davis with DJS. And so we are working to assess the needs and the services for youth and families throughout the state of Maryland, and making recommendations on how to improve our continuum of care. Thank you all. And has anyone not gone yet?
Megan.
Hey, everybody. Megan Galloway. I am on the policy team in the Office of the Secretary with the Department of Human Services. So excited to be part of this effort to make sure that we're doing what we can to be the important piece of this whole picture. So Thanks, everybody. Happy New Year.
Yeah, happy New Year. Sydney, did you get to introduce yourself yet?
Not yet. I'm Sydney Jenkins. I'm with the Governor's Office of Crime Prevention and Policy with the Youth Justice Division, and I focus primarily on the Children's Justice Act Committee and the State Advisory Group on Juvenile Justice.
Awesome.
Right.
Great.
Leaves a Delegate Bartlett.
Hi, everyone. I'm Sandy Bartlett. I am the chair of the Judiciary Committee in the House of Delegates for the state of Maryland. I serve on this committee, on this work group. I didn't change because I think prevention is the start. And I think we've got to get things done on this end. And I want to be available, to be a part of this conversation and see how I can help through any legislation that we need to put in. So good to see you all. And I'm gonna take my video off in a few seconds, but I'll still be here.
Thank you so much. Great. Well, I'm not great at finding the chat inside of Google Meet. Here it is. I was just going to drop into the chat the agenda in case folks needed to be able to reference it. But thank you all for being here with us today. Our next item on the agenda is to walk through our notes from Q1 and Q2. Donna, do you want to start with Q1 and I'll do Q2?
Oh,
Or do you want me to take it off? I'll just take it off. I can take it off.
take it because my computer restarted on me and I have to get everything to reopen again. Right before this meeting, I was like, oh, that's fun. So I'm still trying to find where I put everything.
That's all right. That's not a problem at all. So I'll just get started and just feel free to jump in to fill in any gaps. This was an item that was provided in the email from Suki. It's all of our meeting notes from July 14th through October. And so that everybody, I think, hopefully knows at this point, the way that we have been thinking through prevention in terms of identifying the different gaps that are needed as they relate to juvenile justice prevention is thinking through the hierarchy of needs, and then also thinking about it from an ecological standpoint with regards to the youth themselves, their family and their community, and then legislative and systemically what steps need to be, what gaps need to be filled in order to prevent system involvement. So we started that conversation off starting with like the most basic necessity for all humans, which is food. We started talking about that this past July. We had Maryland Food Bank and Maryland Hunger Solutions come in and really help provide a bit of an understanding about what food scarcity and hunger needs look like statewide. There was a lot of really great information that was provided there. Some really good statistics that were also provided with regards to that. Some of the highlights that we have, and I'll make sure to just, I'm going to give some space at the end of talking about this meeting for other folks to kind of fill in what they really took away from that, if there's anything they wanted to highlight. But one of the things that I thought was really important to highlight was the way in which our legislative codification also needs to expand in order to meet the state funding needs and the way that would get supplemented. Julia Gross talked about that some as she was talking about school nutrition and SNAP. And so that was one piece that I thought was important to lift up. And I don't know, Donna, was there anything from that meeting that you wanted to lift up, or anybody else? I'll open it after Donna goes to anyone else.
No, that was pretty good. That's better memory than I had. So good for you.
I'm going off notes here. I can't attribute that to my
mind. So keep going.
My midlife brain. That's definitely notes. Did anybody else who attended that meeting have anything specifically from the food presentation that we had with Maryland Hunger Project and Food Bank that they wanted to lift up? If not, I'll move on to the next meeting that we had. Going once. Okay. So the meeting that we had after that, we took a break in August. We met again in September, and this was actually an opportunity we had to hear from the Maryland Department of Human Services. Mr. Yi, I hope that I'm saying his name correctly, came and presented on the federal HR 1 and its impact on SNAP benefits and eligibility, and the role in which the federal policy is likely to have on Maryland's benefits. He talked about the different mitigation strategies that Maryland is trying to have in order to be able to continue to have high enrollment and utilization of SNAP. Talked about the ways in which they're trying to reduce administrative burden for re-enrollment and recertification. We talked about the need for like alignment across agencies and the need for interagency coordination. And, you know, this is definitely one of those conversations when we talked about the ecological model that was really kind of focusing on that third piece in terms of like systemic changes and modifications. I don't believe that there was anything in terms of legislation that was specifically discussed with regards to that meeting. I'm going back to look through my notes as well. But it was really good to know that in a time where there was and there is a lot of concerns about the rising like cost of food, and then also the decreased availability of governmental assistance, that Maryland is really being forward thinking and trying to get it in front of what would otherwise be a pretty disastrous situation for many families. And I'm trying to remember the numbers right now. I want to say it was like something, it was like was it in the hundreds of thousands of Marylanders that could be impacted by this cut? I'm going to pull up my specific notes, but if there was anybody else who had anything that they wanted to, Donna, I'll give it to you first, but then I'll open it up.
Yeah, I don't remember the exact numbers. I do remember being kind of astounded by them. So it sounds about right, because it was a lot more than I expected to hear. Otherwise, I think your summary was good. And I think overall, I mean, we still have another one to go through, another meeting to go through, but I think the siloing of our state resources and supports is a theme that's starting to develop, that kids are being, you know, our youth are being served here and they're being served, they're being there, but it's not coordinated, and being in one doesn't trigger another, whereas probably there should be more cohesion. And we might be able to, when we see kids who are accessing multiple supports and services across the state, it's a kind of maybe a way to raise a red flag.
Mm-hmm.
Which, unless somebody else has something to say, that brings us to our most recent meeting, which was the homelessness one.
Yeah.
Go ahead, Aubrey.
Sure. I did find like some numbers, but I can get back to that if folks have specific interest. So our October 20th meeting, we were talking about housing stability and youth homelessness. We had Youth Reach Maryland and the Maryland Department of Housing and Community Development join us for that meeting. We were focused a lot on the experience of unaccompanied youth and housing instability. They helped us really kind of talk about the difference between youth who are, you know, receiving housing services or homelessness services in the context of families, as opposed to youth who are unaccompanied and receiving homelessness services and supports independently. This is one of the places where like legislative or regulatory changes were clearly identified. Jay Unick from Youth Reach Maryland talked about the need to expand Maryland's definition of youth homelessness beyond the HUD criteria. This would help make sure that youth who are experiencing like kind of what's called couch surfing, or who are having, you know, high instability, are also eligible for services, that they don't have to be actually like on the street homeless and without a place to go in order to be able to access resources to secure housing. So that was one of the pieces that was an important change and gap that was identified that had a clearly articulated recommendation kind of attached to it. Donna, did you want to?
And the only thing I would add that I remember from that meeting was that they had mentioned a program called the Sasha Bruce program, and they had mentioned that it was a little bit in Prince George's County. So I went to look it up because that's where I primarily work. So I was interested, and I found that there's only a little bit of it being implemented in Prince George's County. It's really a DC program, and it's really a great program. When I went to their website and read all that they do, it's like, wow, we really should have something like this in Maryland, because they really do a lot for unhoused youth. And so that's something, you know, a model program to maybe look at, you know, as down the road.
Mm-hmm. Yeah, that's a great one. There was also, I think overwhelmingly one of the things I took away from that is that there are more services or opportunities for youth who are experiencing homelessness to get connected to services than who are actually getting connected into that pipeline. It was like under 10% of youth who had identified as having been homeless or instably housed actually were in the Maryland system for receiving those services. So there's like a very big kind of disconnect. So there's probably lots of work to do there. And I think the obvious connection here to juvenile justice, right, is that when you're housing insecure, you're more likely to get pulled into doing illegal activities or unlawful activities in order to have that need and other needs of yours met. Just to say the obvious out loud, I guess.
Yeah.
Did anybody else? Oh, sorry. Go ahead, Donna.
Let's just say another theme that I think goes across all of this kind of low foundational work that we've been doing, focused on basic needs for our youth, is that these lead to our youth engaging in survival crime. And that being kind of the overarching of what are we doing here as prevention? What are we preventing? And this is the direct connection, is that our youth are engaging in survival crimes in order to get their basic needs met.
That's right. Thanks for lifting that up, Donna. Did anybody else who attended that meeting have anything that they wanted to also elevate?
Don't be shy. It's not the Donna and Aubrey show.
Not at all. Well, I'm going to put this out there. Maybe this will inspire some things. Some of the slides, because I took screenshots of some of the slides and I think we shared them out afterwards, but like 44% of unaccompanied homeless youth have stayed in jail or prison or a juvenile detention center. So it's like a high, this is one of those places where we've got a lot of overlap, and like we know where there's like significant criminal and delinquency service systems overlap here. So as we're thinking through our recommendations, just want to, I guess, elevate that. And I also wonder if there might be, I don't know that we have anybody from the Maryland Housing and Community Development that's part of our commission or at one of our, in any of our work groups, but that might be something else for us to consider. Go ahead, Maisha.
Hey, yeah, thank you, Aubrey, for that. The statistic around unhoused youth being detained in juvenile justice facilities because of being unhoused, was that data for Maryland or just like state, national data?
Let me see if I can see the site, but I don't think that it was it was just it was just an incident overlap.
I see. Okay. But yeah, I would love to know if there's some specific Maryland specific.
Mm-hmm.
Yeah.
This was according to a study of runaway and homeless youth who interacted with street out. So I think this was a national data with 11 U.S. cities, 44% across 11 U.S. cities.
I got you. Yep.
Mhm.
Thank you. That's helpful.
Yep. Yeah, and I feel like that's like a great data point too for us. Like, do we have that data for Maryland specifically? And again, to the like coordination of systems, right? And talking about making that happen. Okay, so I think. Oh, go ahead, Megan.
I was just gonna, excuse me, that just kind of jogged in my brain. Sorry, I keep freezing, so I'm just gonna go off camera. And hopefully folks can hear me. But just Aubrey, what you were saying sort of kind of rung a bell sort of about consistent themes across several of the meetings, being the importance but challenges in data collection. So when you're talking about the data, right, all of these particularly as it relates to hunger or kids who are at risk of food insecurity, but then also our youth who are transitioning in and out of homeless status, as we often have it sort of captured and categorized in data that are collected, and the challenges that we face there, and sort of kind of wrapping our arms around exactly who all are being impacted by these sort of like gaps in systems. And that sort of just seemed to be something that came up in a few of our meetings, where it was like, this is the data that we think that we have, or this is the data that we have, and this is what we think that it means. But we also recognize that, to your point, Aubrey, about the systems coordination and kind of ways that we can improve, or still kind of like areas of need, that because of those gaps, we also know that we're not actually getting a full picture of the scope of the challenges in each of these kinds of buckets of need.
Yeah. Megan, your comment is making me wonder if, like, as we're thinking kind of advanced to the finished product that we're going to have at the end of the year, if it makes sense for us to explore having like a section of like gaps in the research, right? Gaps in the data that we want to lift up and try to, get filled, so that we can make targeted, specific, recommendations.
Yeah, I think that personally, I think that would be really helpful.
Great. And I saw another thumbs up from April, so thanks, April. All right, well, let's move on over to our voting and ranking process. Donna, do you want to?
So we have the worksheets. I hope everybody did their worksheet that Suki put a lot of work into setting up. Suki, did you have an envision how we go through this? Do we want to go through each recommendation one at a time, or do people want to lift up specific top priorities for them when they ranked? What were you thinking?
In total, there's around a dozen different recommendations. I think if we spent a few minutes on each, we could get through them. In general, you were asked to state or mark whether or not you support or don't support that recommendation, or if you prefer to revise it or get a bit more information about that recommendation, and your priority level, high, medium, or low. So in the end, what we'll do with your what you've decided is kind of put these into a rubric or something, so that we will see what this group's highest, medium, and lowest recommendations are. Yeah, we will be able to suss out what the top ones are by the end of this as well. So if we could go one by one, these were recommendations that were provided specifically by the speakers. And in the sheet, you will see which speaker made it, at what meeting they made it, and the very specific means by which they mean to provide a solution. It says an explicit pathway for reform or to reform, as stated by the speaker. So it's all very specific, and this group can decide whether or not you agree, or where you stand on these things. This is a way to do it. It's retroactive moving forward. The goal is as we go into the meetings, you'll be actively listening to the recommendations so that by the end of the meeting, we'll have this process. Like, what did you hear? How would you rate them in your mind now so that we don't do this? These meetings are a little foggy, so we're hoping that the review helped to remind you of what you heard and we can get into this. And you've had time with the information that you were sent, so hopefully you've reviewed it all too. They were very, very lengthy notes, and I hope that was okay. I can share screen, and Donna and or Aubrey, if you want to kind of lead this process, we can do that, if that sounds okay.
That works for me.
Okay.
Okay.
There we go, and I'll make it a little bigger. Okay, and so you can.
Okay.
Am I back?
You kind of sound a little bit like a robot. Okay, say it again.
I lost my connection
Okay,
for
now
a
you're
minute.
better.
Am I back? I think I'm back.
Yeah, now you're good to go.
Okay.
All right, while you're on, let's just have you do the first one and we can like alternate.
Okay.
While the iron's hot.
The first one was the recommendation, expand healthy school meals for all statewide. It was came from Speaker Julia Gross with the Maryland Hunger Solutions. The explicit pathway to reform, state legislation to codify universal, you got it shared, okay. And the mechanism would be a legislative change, state funding, administrative implementation. So I feel like I want somebody other than me and Aubrey to tell us how they rated before we give ours away. So I have my rating, but I feel like Aubrey and I have been doing too much talking already. So does anybody want to say whether they rated this support yes or no, and rated it high, medium, or low? Anybody?
Oh, we got
April.
some.
High support and high from April. Thank you, April. Anyone else? I have support and high as well.
Likewise. Okay, well, let's, okay. Oh, Mizuna says also support and high.
All right.
Is there anybody who didn't have support and high that like has any questions, or anyone who said no, or something that needed to be revised? Okay.
So,
All right.
so without objection, maybe we just make it yes and high. Is there any objection to that? Hearing none. All right.
Okay.
Well,
Well,
ask if we're all this agreeable.
I know. So much alignment. Okay, I'll do the next one. The next recommendation was to reduce administrative burden in SNAP enrollment and recertification. This came from Web Ye from the Department of Human Services at the September meeting. The explicit pathway to reform was administrative streamlining, eligibility system modernization, as well as increased state assumption of administrative costs. The explicit mechanism type was administrative reform, systems modernization, and state funding. And, oh, okay. So do you see, oh, I think that it was in an email. Do we have, I don't actually have the Google form. Otherwise I would. April said for this one, support in medium.
Yes, I'm working to bump up the email that I sent to you all, but my computer is slow since I'm sharing screen too.
Yeah. Okay.
Or the title of the full document so I can search for it.
Oh, that I can at least tell you.
Prevention underscore work group underscore voting. That probably will get you.
I can copy and paste the name of it into the chat. I think. There you go. Great. April, thanks for providing your input there, support in Medium. Is there anyone else who wants to provide their input on this?
So I have support and high. And I had a note that the administrative burden is a known access barrier. Streamlining directly improves uptake without requiring new eligibility expansion. So it's strong prevention return with relatively low political risk.
Mm-hmm. My comment, I was supporting high as well. My comment is about the cost of system modernization. I know that for other systems, that process can be pretty expensive. And I don't want to have like difference in cost. As I'm thinking through this and like presenting it forward, when I start trying to think about ranking and where the money goes, I think I need a little bit more information about like what the cost is associated with that modernization. But I think that it's going to have such a tremendous impact for not just the youth themselves, but also for their families, that it's likely worth the investment. I'm sorry. Somebody is ringing my doorbell incessantly. I will be right back.
Anyone else want to add a discussion to F2? Reducing the administrative burden in SNAP enrollment. If not,
Sorry. I was just going to say that I think that with all of the things that are happening in the SNAP space, that there might be, sort of to Aubrey's point about the importance of thinking through the cost and potential challenges there, that there might be circumstances where we're already being required to update certain systems or like change how certain things are being made in order to be responsive to mandates from the federal government. So just kind of like food for thought there, that it might be that we could try to sort of piggyback on existing reform efforts to make sure that they're being done in a way that would kind of facilitate this sort of sharing of information or coordination in a way that would also be beneficial to the things that we're thinking through in this work group.
thank you. Bree or Suki, you good to?
Oh yeah, I appreciate all of the additional comments too. It will really inform the report writing. So keep it up. Doing great.
All right, great. All right, so the next one is F3, promoting statewide use of Maryland Benefits One application. This came from DHS. This would be an agency level directive to expand cross-program enrollment via a shared eligibility platform. And the mechanism would be administrative coordination, shared eligibility infrastructure. And of course, I don't know if the comments that I'm seeing now is for the new one or the last one. I believe we have support and high.
From April. Yeah, I think the previous one was from Mizuna and Munaza. I'm sorry, Munaza. My apologies. And she said support and high as well. Oh yeah, you got that one already. Okay. Yep.
Yeah, my support and high was for the SNAP application.
Okay.
Thanks.
Yeah, I'm a yes in medium for this one, only because I think it's complementary to F2, but secondary to it. So it's kind of like you could do F3 and F2 together. That would be a way to reduce the administrative burden, is with the unified application. You know what I'm saying? Like, I feel like one is the other, but one happens through the other one.
I actually I put needs revision or more information, and only because I was thinking specifically from like the youth standpoint here, like how do we make sure that, like, I'm not clear on like what youth's access to the benefits one application is. But as I was trying to think kind of cross systems wide, like, are youth able to use that if they're experiencing housing insecurity and instability? If they wanted to like look into housing resources or benefits, like we work with some youth who have a lot of responsibility, especially 16, 17-year-olds have a lot of responsibility for their households. Just wanting to make sure that whatever that process and the application updates also, and the promotion and use of it also was like youth friendly. So
Anyone else? Going once? Just for Suki's sake, when she's putting this all together later, basically what I was trying to say was like, I saw this one not necessarily as like the headline recommendation, but like an objective underneath the previous recommendation. That's what I was kind of trying to say.
That part of the like eligibility modernization might be, or increase. Yeah, I guess it's like a little bit different in terms of like what's happening.
All right, we ready to go to the next one?
Yeah, we are. F4, strengthen workforce development pathways, addressing economic roots of food insecurity. For example, FoodWorks. And this was a recommendation from Meg Himmel from the Maryland Food Bank. The explicit pathway was program investment, braiding funding, and employer partnership to create job pipelines. And the mechanism type was program funding, workforce pipeline, cross-sector coordination. Manaza says support high. Looks like April also said support high. I also said support high.
Actually, needs more information or needs to be revised. My note was that it's conceptually strong, but risks drifting into economic development without clear prevention metrics, and would benefit from a tighter articulation of youth and family stabilization outcomes.
I guess I was making the assumption that by helping youth develop workforce skills and have opportunities to work in food insecurity, that it's kind of killing two birds with one stone, of like giving them a means of earning money without, so that they don't like get further involved in survival crimes, and then also helps provide additional food resources to youth.
Yeah, so, I think conceptually I get the idea. I just don't know that it's baked enough.
Yeah, fair enough. Like we need some more specifics, more meat on the bone.
Or we could put it like in a report and really be able to make it actionable.
Yeah. Maybe this is an opportunity, like when we're getting ready to kind of solidify all of our recommendations, maybe this one and any other ones with like needs more review can have like some subgroups of folks working together to kind of crystallize what is really being put forward.
Because it's such a broad statement.
Yeah. Did anybody else have any thoughts or discussion that they wanted on this one? Going once? Hearing none?
All right. I think this one was, is this one my turn?
Yes.
All right, I'm switching back between all my screens. All right, I think that we're on H1.
Right.
Expand youth homelessness demonstration projects and host home models. Came from Reach, Maryland, Department of Housing. Scaled YHDP allocates state funding for host homes and coordinates with providers. And then funding expansion, program replication, and interagency coordination. My favorite part, interagency coordination. It's such easy words, but it's so hard to actually implement.
Yeah.
I'm not clear on what that means as far as the youth homelessness demonstrations and host home models. If someone can explain what those are.
Yeah, let me pull up my notes on the models. But if somebody else is here and wants to jump in before I get there, feel free. Because I actually put needs needs review. So
Suki, do you remember, or do you have more information? I know you're trying to take notes. So.
No, and I have not. We'll just, how about we come back to that one?
Yeah.
Since the table wants some more information too. Yeah. All right. Fair enough.
oh right, okay. I was just needing to jog my memory about. So this is like an opportunity. The youth homelessness demonstration partnerships, they're kind of like bringing together like a coalition to create like pathways to help youth exit or enter into housing security. And some projects that they can do that through is FYI vouchers and FUP vouchers as well. FYI is like foster youth independence, family unification program vouchers. I'm trying to think if there are other like housing choice like vouchers. So it's like kind of creating partnerships between different programs and agencies to be able to create a like youth specific way to increase housing stability. That was my understanding of it, but we can also ask for more information.
Yeah, I'll get back with Jay from Youth Reach Maryland and get more information on that for y'all for next time.
Okay.
Yeah,
Should we move on? Oh, sorry.
I can give you just a link to the HUD resource from on youth homelessness demonstration programs. I'm not sure about the host host homes.
Okay. Thanks, Donna.
Mm-hmm.
Should we move on to the next one? Okay. H2, strengthen the role of McKinney-Vento liaisons for early identification. And this was a recommendation from the presenters from the Department of Housing. The explicit pathway was administrative clarification of roles, targeted funding, informal coordination with housing providers. The mechanism type for this would be administrative action, targeted funding, and coordination framework. So
Anyone? I can put that I did support and high. my comment was that schools are a most consistent point of contact for unstably housed youth. And clarifying and resourcing this role is a practical prevention-centered recommendation with immediate impact.
Yeah.
Kind of like low-hanging fruit.
Mm-hmm. Yeah, and it doesn't have any like legislative needs attached to it either, which feels like it's much easier to get done.
So it's the gap that there's not much awareness about the liaisons.
Right.
Mhm.
And also I think like helping liaisons also kind of understand their role in prevention. Was how I was understanding.
Mm-hmm.
Yeah, I also put it down as support and high. And it looks like April put support in medium. Oh, you already have that, sorry. Okay. I should just always assume that Suki's ahead of me. All right, Donna, you're up.
All right, my turn. What are we on? H3. All right. Expand Maryland's definition of youth homelessness beyond the HUD criteria. This would require a statutory change to include couch surfing and doubled up youth and align eligibility across systems. It would require legislative change and cross-system policy and alignment. I do remember them. I remember that specifically from the presentation that was part of the data challenges, is because there's all these different, every administration silo is using its own definition between local, state, national.
Yeah, I joined Manaza and support and high.
Me too. I think it's kind of like you kind of have to if you're going to be really intentional in reforming.
Yeah.
We have to be able to identify before we can prevent, right? Like you can't prevent what you can't identify.
Yeah. I mean, there are some like universal like approaches to things, but with regards to this one, it's yeah. This ain't one of them. I'll move on to H4, improve data integration among everybody. Department of Housing, DJS, MSD, MLDSC. This came from the Department of Housing as part, or is an idea that arose from the Department of Housing. The explicit pathway is formal data sharing agreements, standardized data elements, and routine interagency reporting. The mechanism type is the Department of is data governance, administrative agreements, and reporting mandates. So yeah, I'll wait and see. Manaza, was this your support and yes for this one, or was that?
That was for the previous
That was
one.
previous one. Okay.
I'm about to write support high as well, but for this one, but it's still, you know, it needs more, a lot more conversation regarding like which platforms we're using and how that transition would go, and also like there's so much I wanted to write down regarding that, you know, what it looks like, because I think depending on what we're using, it can be a complicated transition for some folks, but also still absolutely necessary, right? But my thought also goes into just how to, like, how we can access it easily. Like, what's the public facing version of it, if anything, and also like internal use. But yeah, absolutely a high priority. I think
Yeah, like a dashboard or something like that.
Mm-hmm.
Yeah. Did
Yeah,
I
said yes, and I put it medium mainly because something has to be medium. But I think it's critical enabling infrastructure, but it's something that's going to be really complex. It's going to need, you know, anytime you're talking about data, then you have to have recommendations that have, like, for guardrails around how the data is governed, the privacy, and how you roll it out. So it's a more complex one that would require a lot more intentionality to it.
Yeah, I was going back and forth on this one a lot actually, because I was when I like, obviously you need the data in order to inform your prevention efforts, but it, I guess, kind of to Donna's point, like no hard to show like impact, right, specifically from doing data integration. The other piece is, I know that there's some level of like data integration that is happening amongst some of these pieces. Like I know MSE and DJS do some data sharing already, and so it would be helpful for me to have well, I guess I'm not the one having to draft the agreements, but insofar as there's already data sharing happening, do we need to be more specific about what type of data explicitly needs to be getting shared across these groups? Because it seems like they're already in the room together sometimes, but this is not on their radar, I guess, because we don't have the data, or maybe it is and we just don't have access to the data.
Even within agencies, there's different platforms within one agency, you know, one that's like case management's focus and another one that's for like, you know, other resources. And so it's
complicated.
it's complicated even within one agency, right?
Yeah.
I feel like more conversation needs to be had about like what's the stepwise progression into integrating these things. And like you said, like what all needs to be integrated and in what fashion for it to make sense without it being a shit show trying to, you know, do it all at once, right?
Yeah.
So I think a stepwise progression needs to be a part of that review.
Yeah.
Yeah, I'll just echo everything that Munaza just said about our agency as well, in terms of each having their own, silos, I guess, for lack of a better word, within the agency more broadly, but then also just flagging, you know, I'm sure everyone is on the same page in terms of the data privacy of the folks who would be, you know, particularly the people that we would be looking to capture information about. So I do think that we do err on the side of caution in terms of keeping the, you know, the people who have access to the data on the as small as possible. So to your question and point, Aubrey, about you know, maybe it would be helpful to have it kind of spelled out a little bit more clearly about what exactly, what types of agreements, what kind of data would be helpful moving forward. Because one, I think to the point that everybody else has sort of made, sometimes they do exist, and it's just that people don't, not everyone is sort of in the loop, so to speak, in terms of the fact that they do are ongoing, and not everybody is aware. But then also to the degree that they need to be expanded, I think we do need to be really precise about how they should be expanded and for what purpose, so that we're not just expecting these kinds of agreements to take on like an overly broad kind of scope, which I'm sure we're all kind of on the same page would also not be ideal for other reasons.
Yeah, very well said. Well, there'll be lots of really great things to put in the draft of of this recommendation, the substance around it. I think yeah, this might be another one where we do a lot of group talking and drafting to make sure our thoughts are well articulated and clear. Can I add one thing just to something to circle back to when we do have that conversation? It's like talking about this data. Are we talking about like aggregated data? Are we talking about like individualized data? I think that for me like puts me more at ease when it's aggregated data sharing that's happening and integration that's happening across agencies, especially if it could move into data sharing at the federal level or be used by the federal level. Okay. Oh, go ahead, Megan.
Sorry, I was just gonna make a quick point on that. in terms of aggregate versus specific data. I do want to flag that, you know, we do have some data sharing agreements with GJS, for example, and depending on how closely you slice the data, you might be looking at data sets of like 3, 4 people, right? And sometimes that's not even being too prescriptive in terms of what you're looking at. That might only be kind of factoring in, you know, 3 different kind of layers that you're looking at. So sometimes that might be just raising that as a potential challenge, even if we are looking at aggregate data, is that sometimes the data sets or the, you know, that you might have like an N of 5, which still kind of makes it really difficult, right, to de-identify in a meaningful way.
Yeah, great point. We are at time, I believe, right? Is this meeting an hour and a half or just an hour?
We are at time, and the last thing on here was just that this group will treat food and housing stability as core prevention infrastructure, and then we'll continue to look at them. And then there are other recommendations just for the sake of transparency that we did get that didn't have a solution. So they were not lesser or less important, but they didn't have a specific mechanism. So they're on here. I have a sneaking suspicion that this group did not get the email with this information because Munaza sent me an email like, I don't have this stuff. So that's terrible news. And I think that something terrible happened with email. So I'll make sure. I hope that's not true. I hope that y'all, oh my God.
I was gonna say, I got it, but I don't.
Yeah, I don't think I got it either, Suki. I don't want to put you on blast, but yeah, I don't think I got it.
News ever. I'm going to chalk it up to email and not to me.
That's enjoy.
It'll come out because I think we should still spend some time looking at these. And then when we come back next time, we'll go through the results of this and then we'll kind of recap and folks will have another opportunity because, wow, we are at time and then we will move forward.
Yeah.
That's all I can say. Thank you, everybody.
Thank you so much.
Thank you. Take care.
Thank you. I'll see you next time.
Take care.